Well, I'm glad to see everybody here all smiley and everything. It's a wonderful day. Okay. Item one we have is approval of agenda.
Mr. Chairman, I move to approve agenda item 1.
Second.
Motion was made and seconded to approve item one. All in favor, say aye.
Aye.
Motion passes. Approval of minutes,
I move we approve the minutes as submitted.
and I'll second that. Motion was made and seconded for approval of item 2. All in favor, say aye.
Aye.
Motion passes. Approval of account payroll, payable and payroll.
Move to approve.
Second.
Motion was made and seconded to approve item 3. All in favor, say aye.
Aye.
Motion passes. Now we have public request, and I know each and every one of y'all want to say something, so please step up to the mic. I love this group of people. Okay, item 5, informational presentations. Carmela?
Oh, wow, I've never seen anyone go through an agenda that quickly. I love this group. This is pretty amazing and efficient. Hello, Mr. Chair, members of the committee, and other distinguished members of the municipality and constituents. My name is Carmela Martinez, and I'm the Director of the Income Support Division under the Human Services Department, and I'm really grateful and thankful to be able to be here in person. Thank you very much for extending the invitation so that I can just share a little bit of information for starters, but I'm really here to listen and really get some information and feedback to hopefully better improve access and retention of services that are afforded to your constituents. So on the next slide, we always start off with our mission. I saw you guys had a great vision and mission, so you can relate. I'm not going to go in a lot of detail for all of these, but our mission is to transform lives. Working with our partners, we design and deliver innovative, high-quality health and human services that improve the security and promote independence for New Mexicans in their communities. That's really my favorite part of that entire sentence right there, is where it says, in their communities, because it's critical that we don't have our customers come to us, that we go to them wherever possible. And I think that's a common objective that we have here today. So I think that's really great. We have a goal around access. We have a goal around communication, public trust, and also an internal goal for employees. But ISD really lives in one wheelhouse, Income Support Division, and that's around goal 1. And that's making sure that we are providing the services to constituents and that every qualified New Mexican receives timely and accurate benefits. That is my sole goal as a leader at Human Services Department. On our next slide, I just kind of, we always start off at Human Services Department acknowledging that we are humbly on the unceded ancestral lands of the original peoples of the Apache, Dene, Pueblo, past, present, and future. And it is with gratitude that we pay our respects to this land. It is always nice to kind of make sure that we are thinking a bit beyond ourselves when we come into a meeting. All right, so thank you for this community forum. Again, the objective is to provide an opportunity for the community to share ideas on how HSD can better serve your community. Introductions, I did that. Short presentation, and then I assume I have some time for some questions and recommendations, I hope. So on the next slide, this is the HSD leadership team. This slide deck has been shared with Ms. Hamilton, so she can go ahead and share it all with you folks there with the contact information for our HSD leadership team. On our next slide, this talks a little bit about who we serve. As of May 2023, we serve 1,083,790, is that what that says? 290 fellow New Mexicans. Now, it may not seem so impressive when you think about states like Texas and probably the amount of people they serve, but the population of New Mexico is about 2.1 million people, which means that we are servicing close to 51% of the population of the entire state. And it is a commitment that we do not take lightly. When you're servicing that many people, those are your friends, those are your family, those are your neighbors, those are people you sit next to in church. So it's critical that we attach people to these lifeline services. This is just kind of a little graph on the left that kind of shows you how we've ebbed and flowed. And we're, again, trying to rebound from the pandemic and having closed offices, but we are 100% open now. Continuing who we serve on the next slide. On our HSD website, once a month, we update, right? The first slide was numbers, but we're not servicing a number. We're not servicing a piece of paper. We're servicing an individual. We're servicing a family. So over the past year, we have attached over 510 million meals to families and put that on the table. We've gotten over 964,000 individuals to healthcare and attached them to that. So you can really see the social impact that we are committed to in our goal and our mission. Underneath there, I put some stats specifically around Roosevelt County and the enrollment numbers specific to Medicaid, et cetera, and it compares it to the state average. And so you can kind of see, the state caseload, so you can see the percent of population there. And I apologize, I thought I put my ringers on off, and I guess I didn't. All right, next slide. This is just a brief overview, a very kind of 30,000 foot view of the services that we provide at Income Support Division. The first one is SNAP, formerly the Food Assistance Program. That includes as well a myriad of other food box programs like the Emergency Food Assistance Program, Senior Commodities Program, and most recently during the pandemic, PEBT, which is Pandemic EBT, where we were attaching students that were displaced due to COVID. Sometimes the only meal that they get, or the really only nutritious meal they get, is at school. And so we've replaced those benefits with a federal program called Pandemic EBT. The last issuance of that benefit has officially gone out. However, our federal partners, Food and Nutrition Services, FNS, is replacing that with a summer program, and we will be on track and on board for next summer to be able to implement that program to attach students out of school during the summertime with some EBT assistance. We have a myriad of cash programs. Temporary assistance to needy families is a 60-month lifetime limit for families with dependent children. There are work requirements associated with that program. We also have a general assistance, which is specific to disabled adults while they're pending approval of SSI. And most recently, we pay for an attorney to help them get attached to those SSI services. And that's a recent initiative that we've undertaken at ISD. We have a plethora of Medicaid programs from women, that help children, that help parent caretakers, adults, which is an expansion of the program, Medicare Savings Program, which helps lower income seniors pay for that deductible that they have to, that premium that comes out of the monthly Social Security every month that can help families pay for that, as well as some very specific waiver or institutional care, developmental disabilities, much more specific, broader scale Medicaid programs as well. And lastly, we have our Energy Assistance Program. Once every federal fiscal year, you can apply to receive an Energy Assistance Program payment that goes directly to the vendor. But this is also applicable to wood gatherers or people who use wood that either gathered on their own or pay for it to either heat or cool their home. So I think in this area, we get more people asking for cooling assistance than we get heating assistance. And I've just been here a day and I'm getting used to it. I looked at the clock at 8:30 last night and it was still 98 degrees. And that was a little different for me from this northern girl here. Next slide. This is just a bit of an overview. ISD manages 34 offices statewide. We do not necessarily have an office in every single county. For example, Bernalillo and our Albuquerque area has 4 offices, but we are spread out, and we also have some satellite offices where we go and we visit communities where maybe we don't have a regular office, but we have a regular schedule to help reduce that commute and transportation barrier that maybe our constituents have. And we do that model in several places throughout the state. In February 2020, HSD hosted a community forum, both in English and Spanish, with the wonderful Portales area. And y'all gave us a lot of really great input and feedback, and we were able to find a partnership. During the public health emergency, of course, all lobbies and drop boxes were closed. We had some curbside services. It was very limited. It was, and we get that it was a challenge. Well, we're getting back to not normal, but sustainable, and something I hate saying new normal, right? Everything's the new normal anymore. We are getting to a more sustainable business model. In June 2021, Roosevelt ISD office was co-located with CYFD. We had our own self-standing building. It was much, much too large of a footprint for us. So we were able to find a partnership with CYFD, and we're thankful for that. Our office hours are Monday, Wednesday, and Friday. Friday, because I was really excited about Friday, I guess, when I did this. And we are open from 8 a.m. to noon. On our next slide, it kind of breaks down a little bit. I compared Roosevelt and Curry because they're just the closest offices to each other. A statewide comparison, it's just too much of a population to compare. Curry or Clovis is on the top. Roosevelt Portales is on the bottom since January of 22. This is the through the door totals in a month. So this is how many people came to that CYFD office during those open hours to speak with an employee there. She is a supervisor level employee, fully trained, and has very well seasoned with the income support division. On our next slide, this is a little bit about the volume. So the application received by type. On the left, you have what's called presumptive eligibility workers or presumptive eligibility determiners. They are not housed in our ISD offices throughout the state. The model is mainly at hospitals, other community centers, etc. They are trained. They can determine an emergency medical eligibility approval process as well as regular long-term Medicaid. There are 11 PEDs in Roosevelt County. 6 are at your hospital, 2 are at La Casa Family Health, 2 are at the regional education on the ENMU campus, and 1 is an admin here at your Roosevelt County building. I'm assuming that's where it's located. Since January, we received a total of 38 applications from that PED process. 8 have come from the hospital and La Casa respectively. 6 from the hospital in February, 8 again from the hospital, and 4 from La Casa for March, for a total of 12, and 5 apps from the hospital and La Casa. So you can see where the real volume is coming from. Since 2013, inception of our new eligibility system, we've received around 8,000 applications online and around a little over 7,000 applications through either paper, which is our drop-off, or lobby. So they either left it in the drop box or they actually presented it at a lobby. That's around 14 applications a week, physically dropped off at an office if I average that out since 2013. On our next slide, I just wanted to remind everybody of the service delivery options that we offer. It's important that we have a wide variety and opportunity of customers throughout the state to reach us. There is the ability to do phone, IVR, or chat. And the chat and IVR is a 24/7 real-time customer service interaction. The phone is 7 a.m. to 7 p.m. Understanding that it is a bit cumbersome to use the call center, but it's important that if somebody wants to use a call center, they can access the same services as if they went through the door or online. We want them to all be the same level of service. We are constantly revisiting and evaluating how to improve the phone service and have recently brought on over 300 additional staff to support that call line to reduce wait times and improve the services that we are providing there. Again, mail and fax, if you can still find a fax machine. Really, it's our doctor's offices, by the way, that just will not let us get rid of those fax machines. And so you can snail mail, you can fax it in, any documents or applications, and they will get attached to us. And lastly, there's online. We have our Yes New Mexico online portal where you can apply for benefits, you can renew benefits, or you can change or report any changes to your benefits. Lastly is real-time eligibility. This is specific to Medicaid only, and it's pretty amazing. It's also called express eligibility. This means you can go online to Yes New Mexico, and if you have all the right information, and then we also bump up against interfaces to verify as you go, you can actually get a real determination of approval for Medicaid in real time. And so that is a pretty amazing feature for customers to be able to have accessible to them. On the next slide, I just wanted to highlight some challenges. With the pandemic, it was critical that people were retained on services. So we exercised every waiver, every flexibility, every exemption possible to retain our customers on Medicaid and SNAP programs. That means for about 3 years, our customers had about zero contact with us. They did not have to provide us anything. We were constantly renewing them because it was critical that they still had this safety net programs to rely on during the pandemic when their wages were either zeroed out or very, very minimal. And now we're unwinding that, and we have some federal requirements around that. We have about 4 years of work to accomplish in 1 year. I do have less staff than I did going into the pandemic, and we have a higher caseload. And the first 4 months of this unwinding, we're concentrating on the Medicaid cases that we believe to potentially be ineligible. Okay, so we've been able to bump up against data sources and say, yeah, it looks like Amber has new employment and it's really going to exceed the income limits. So she's regained her employment. Great, right? She was able to do that with the workforce. But on the downside, she's most likely not eligible for Medicaid ongoing. So we're concentrating on that population the first 4 months so that we can have a seamless transition to the Be Well or New Mexico New Mexico exchange program for that. So these are just some of our unwinding goals to let you know that we are experiencing statewide challenges right now, which is unfortunate for our constituents, but we are getting very creative in ways to try to help and support them. We are bringing on over 200 contract staff to support us in processing. We are, again, improving call center staffing, and we are also hiring contractors to make outbound calls so we can make sure that we are attaching people to those benefits and being proactive about keeping them and retaining them on that. On the next slide, this just gives kind of a bit of a breakdown of what our year, that 4 years of work in 1 year really looks like, and a little bit of that timeline and what those numbers look like. We're starting off with about 110,000 New Mexicans from April through July that we believe will potentially fall off the Medicaid rolls. On the next slide, this is a critical reminder, and I pitch this everywhere we go. It's time to renew New Mexico. There are radio ads, television advertisements, billboards, really, really great on renewnewmexico.gov, really, really great stakeholder and community partner pamphlets and campaigns specific for the role in your different agencies. It would be really, really great if you were able to help us advertise for this so that people understand when you see that turquoise envelope, please, please, please get that back to us so that we can make sure to reevaluate your eligibility. Again, it's retraining customers. They haven't had to have contact with us in 3 years. And we really want to reduce that churn. And if they aren't eligible, we want to refer them to the appropriate location so maybe they can get attached with a service that can best fit their needs. On the next slide, this was just some questions that we did from the original forum. I know that there were some questions that I received. I think I answered most of them. It was around call center. And yes, we know that the call center is a bit cumbersome. Every member of the HSD leadership has used the call center line to apply for benefits and renew benefits. So we have gone through that exercise. So we know where the pain points are and where we need to improve. And we are putting time, money, and resources there to do that. I think that's about it. On the next slide, I think is just my contact information and different resources. A lot of the data that you see comes from our HSD data book, which is quite comprehensive. It has national, state, county level statistics, as well as links where you can find a paper application online to print out, online applications, and my email. And I guess we just kind of open it up. I don't know how you would like to continue the forum.
Mr. Chairman, I'd like to take the floor if possible. Good morning, everyone, fellow commissioners. First and foremost, thank you for being here. Secondly, I want to thank Carol and Amber for making this happen, bringing it to fruition. Thirdly, that was a lot of information
It was
disseminated. But what prompted this meeting is over the last several months, and of course, there was a lot of unknowns from post-pandemic, and this is one of the things that now I'm obligated to address because as a Roosevelt County Commissioner, I receive calls on a constant. As a person who works with behavioral health, as a community liaison, we cover 5 counties. Roosevelt County, we receive calls at a constant in reference to Human Service Division income support. So there for sure will be at least 1 or 2 advocates here that will be able to speak as to what issues we want to address. There may or may not be YouTube individuals posing questions. I know that I um, requested that if they wanted to partake, that they could do it also through the computer. But one of the things that I want to discuss before we bring Bilad up on the podium is, the hours has been one of the biggest issues. Transportation has been one of the biggest issues because of individuals that would have to go to Clovis. We come from a very poverty-stricken um, county where a lot of the elderlies, individuals with disabilities cannot make it to Clovis to receive these services. Like I mentioned, the pandemic has had a lot to do with it. You also mentioned that Clovis, you compared Clovis to us, which is really not comparing apples
No,
to
it's not.
apples. It really isn't. And do you track all the Roosevelt County residents that do go there for services, that do have a means to go there to Clovis for the ISD services? Do you track, like
We
if
just
someone,
track all Roosevelt through the door totals. Yeah, it's not, we don't
Okay,
individualize it
because
in
at
any
least
way.
I would say that those who have the means, probably 50% plus, would be my guess that go to Clovis to receive services from Roosevelt County. So that's not going to be accurate as well. What I noted is there was an individual a professional individual that invited me to go with the transient person that was recently came in, and the adult probation and parole office was housing him at one of our local hotels, and he just needed to get recert. And without disclosing too much, I was pretty disappointed. I attended with the client and with the professional individual, and the services that it was just very disheartening. Nothing to do with y'all's worker, because she's phenomenal. I've dealt with her in a professional capacity for many, many years. Had nothing to do with that. It had to do with the accommodations, lack of, had to do with the facility, unprofessional, had to do with privacy issues, which really concerned me, that things are being done in front of other individuals that have really no business knowing. Um, as a young parent, me as a very young student at a university where we were pretty much, to make it in life, we had to receive y'all services for a very short period, my wife and I, raising kids and being full-time students. I remember how humiliating it was for me I don't know if it's because I was a man or whatever. But when I showed up with the caseworker, it was very comforting to be behind closed doors, one-on-one or two-on-one, my wife and I, and usually our kids in cribs or whatever, visiting with that individual to ask for product forward that would help with our daycare. A little bit of, food, EBT, well, it was called food stamps back then, so that we could eat, and we worked and we, as much as possible, we did everything possible. We did need y'all, but the privacy was the biggest. And there is a huge lack of.
Mr. Lopez, is that at the new building, the
At the
CYFD
CYFD
location? Okay,
building.
thank you for that
And
clarification.
the other thing that I'm very concerned with is one of my very good friends I was born and raised with, has been with CYFD for many, many years. I have to contact him through his personal cell phone to try to contact the person that's at ISD.
Oh, yes. So there was a question that y'all provided around that. So our contact information on our website is correct. If you use Google, people can say, oh, I need to edit this or I need to change this. Customer input is there. Somehow customer input has changed those numbers. And we have this problem across the state, and trying to fix this with Google is probably easier to get an act of Congress through.
Right.
It's extremely difficult to correct that. And we're really struggling with that in other different offices. It's really causing a challenge because the first thing that pops up is Google when you do a search, not, the second or third one is our HSD website. So it's really difficult for us to correct that. There is no way to contact an ISD office directly. It is 100% the call center.
Right. And I'm going to tell you something, because, the Rio Grande corridor is much different than the eastern part of New Mexico.
Mhm.
I mean, it's night and day. I have a lot of family from northern New Mexico, and I have a lot of friends. And I know that they're having a lot of issues as well in the rural part of northern New Mexico, whether it's Rio Arriba County, whatever it may be. But Roosevelt County, we're a small community with a lot of individuals that are still old school, that they're not going to have IT access. They don't want to have IT access. but they have major needs that they need through ISD office.
What's an ITX?
So-
I apologize.
Pardon me?
What's an ITX?
No, IT. I'm sorry.
Oh, technology. Sorry.
yes.
Okay, sorry.
My
Thank you.
bad.
No, no, it's okay.
So with that, we just want more access. We want more access to where it's more on a personal level. We don't want to depend on elderlies or anyone else that's not IT savvy to have to be forced to learn it or not receive services. And I think it should be priority one. I know that you guys say you got 4 years of work to do in 1 year. What's happening now during that 1 year, 4 years of work that you guys are doing in 1 year to address one issue? I mean, we have a major issue right now. This is also a university town with a lot of families that come and live in family housing, a lot of single mothers and fathers in this day and age, sadly enough. But they're always in need. But they're IT savvy, so it's not going to be as difficult for them. But it's our elderly, and we have a huge migrant community here as well because of the agriculture, the dairy, and the ranching community. And I just think it's something that needs to be addressed, even if it would be an office at CYFD that was private and more hours, more accessibility, to be honest with you. And with that, I'll stand for any questions from anyone or from you. And if there's no questions, I would like to turn it over to Pilar, who's a huge advocate, especially for the migrant community here and the seniors here in Roosevelt County. And she's done it for many years.
Gladly, I'm here to listen and get information. Thank you.
I just came to support.
Well,
Well, I
can you
think
get
different
up and,
people might be online,
yeah, and
so-
just introduce yourself, please?
Good morning. My name is Pilar Moreno, and I'm an outreach worker for Roosevelt County. I've been doing it for 30-something years. And I came this morning because I'm really worried about the families in our community because there's, like you said, there's a lot of technology now, but there's families that don't have resources for that, and I think that the elderly are the ones that, I transport people to the income support, but when you're open from 8 to 12, it's just hard to get seniors there, to get up at 9 or 10. We have difficulties with the seniors and also with the families that sometimes they don't have transportation. There's a lot of need that we need more hours if you can help us with that, and also to be able to help our families in our community. I'm very upset, that we go into the office, and I've been there sitting down with my client, and there's like 5 or 6 people in the same room, and they go and just tell you, what is your need? So there's 5 people around you that you have to answer that question. And it's also embarrassing already that you have to go ask for resources, and then have to do it in front of everybody else. I think that we need to get better service than that. So kind of, we're different than your Santa Fe,
Right.
yeah, we're different. We're down here. So I'm asking for you to give us more hours and to help our communities, families, at low-income families. Thank you.
Thank you, Pilar, for being here.
Commissioner Chair, can I say something, please? So I also had an elderly couple that needed assistance, and they came to me. I tried and tried. I went online, and according to that, it's been over a year. It still says pending. Until about a month ago, it would still say pending when already getting the services and in a nursing home. But I kept trying with that, and I never could get a response for them with the Yes New Mexico. I tried calling the office number over and over, and I would leave the message that I would get a call back, never got a call back. I finally had to actually, just like they come to us as commissioners, I went above and I went to one of our state representatives. They ended up getting in contact with somebody that was able to finally get contact with us to get them some care, because it was an emergency need. He had had a stroke, and it was an emergency need. It was horrible trying to get a hold of anybody. And not everybody knows that you can call your commissioners for help, or you can call your state representatives. People just don't know that you can call them to outreach, and not all of us know who to contact when they do call us. So we just keep going above the chain. I just think there needs to be a way that there's easier access for your elderly, because they're, like everybody else has said, there is a lot that does not do things online, or that's going to hear or understand well enough when you have to leave a message and then they just sit there waiting for a call that doesn't seem to come in.
Thank you.
Mhm.
Did they get attached to services, or do I need to get information from you after?
They got them finally.
Okay, thank you.
Anything else, Mr. Savage?
Somewhere in your presentation, I didn't get the address of the physical location of the office.
I don't know if I included it, which would have been silly. Yeah, I think you might have passed it.
Oh.
It is, I thought I included it right there. I did not. I took it out by accident. It is your CYFD location. I just passed it last night on the way to
Whoa.
dinner.
Slowly.
I don't have it on me. I have to get it for you. I did pass by it though last night to find it. So I'll get that address for you.
CYFD office in Portales, New Mexico.
Have no more.
Dixon, you have any further?
I'm good.
Thank you very much.
Thank you.
Thank
I'll
you so
follow
much
up
for
with
being here.
Amber. Thank you so much.
And safe travels.
Hitting the road, 4 hours. Thank you.
Thank you for coming.
It's 1500 South Avenue D.
Yeah.
Okay, Green, do you have something
Yes, sir.
for us?
Yes.
We're anxiously waiting.
D is in dog.
D is in dog.
Thank you.
So first off, thank you, Amber, and thank you, commissioners and Mr. Chairman, for the invitation to come and give you an update today. I apologize. That was my phone. So I brought some folks with me that I'd like to just briefly introduce. First is our board chair of the Board of Trustees for Roosevelt General Hospital, Mr. Paul Benoit. Next, I've got our Chief Financial Officer, Andrea King. And lastly, Jeanette Arantia is our Director of Marketing, Public Affairs, and Dietary. So they're going to keep me straight. If I forget anything or I misstate anything, I'm relying on them. I am going to try to keep this at a very high level. I could literally speak on this topic for hours. So I'm going to try not to bore you all with that and share with you what I think is the really key information. So the first thing I want to talk to you about is just why we're in the situation we are. You all know that RGH is now facing financial constraints. And just in summary, what I will say is that we are still experiencing extremely high costs as a result of the pandemic. It's almost a perfect storm for rural hospitals throughout our state because we've dealt with high costs in specific areas before, but it is across the board now. So about 70% of our expenses are directly related to our people. We are a very people-rich industry or people-heavy industry based on the nature of what we do. So we have seen increases in minimum wage that have had impacts on positions that we've had to make adjustments to. So our labor costs have gone up significantly. Our supply costs are starting to level off, so that's good news for us. At the same time that we're seeing these increased costs across the board, we've also been hit with slow payments from some of our payers, and just other real increased costs that we can't control. And I'll give you just one example. Our insurance costs total, that includes our malpractice, our property insurance, everything went from around $680,000 in 2022 up to over $1 million this year. Those are completely outside of our control. Our medical malpractice, for example, went from from $330,000 up to over $670,000 this year. And that was the cheapest quote we got. The insurance carrier we had been with for 3 years, they came in with a quote at over $1 million. So these are just a few of the things that we're facing right now. The one thing I do want to stress is that healthcare is a business, but it is also very different from other businesses. For example, and I'll just use McDonald's, if their costs go up across the board, they typically offset that by raising their prices. We can't do that in healthcare. And when we do, it doesn't have the results because approximately 60% of our payers are Medicare and Medicaid. And it doesn't matter what we charge, they pay based on a set fee schedule. So that gives very little wiggle room for us with our commercial payers that are about 30% of our payer mix to make up that difference on. So once we realized that we were on a trajectory that was not sustainable, we started taking some immediate actions. One of the things is we did analyze our charges. We're going through that process right now. We are increasing our charges, but it takes time. We have to give notice to, we've got at least 58 to 60 different contracts with different payers. All of those have to be renegotiated. So we are in the process of doing that. We had to give notification 60 to 90 days that we were increasing our prices to some of those payers. We anticipate those changes will take place on July 1st. Again, nothing immediate, but we are doing that. We've also taken a real critical look at our internal operations and the contracts we have in place, which are expenses for us. And we've identified that there are a few that we can do without. And there are some that maybe we just need to change vendors and look for less expensive options in the future. So all of that has taken place or is in place now. We are starting to see the results of that. The most drastic action that we had to take was reduce our workforce who were full-time from 40 hours down to 32 hours. Just this week, I'm pleased to say that we've been able to get our frontline staff, and that's anyone below a director or a leadership level, back up to 40 hours this week. So we have made some progress that has allowed us to do that. I think our leadership, our directors will have to stay on the reduced hours for another couple of weeks, maybe a month. And then finally, our executive leadership team, it may be a little bit longer for us, but we're right there in this with our frontline staff, and they are our priority, as are our patients. Let's see, what else did I want to share with you all? This is not something that's just facing RGH. We have a New Mexico rural hospital network that we are a part of in our state. And on June 1st, 9 hospitals went up to meet with the governor's office. And Paul went with me just to share what we're all facing across the state and frankly, across the country. If you're a large hospital and you've got a large population that you serve, it's much easier to offset these increased costs than it is at a small rural hospital where we just don't have the volume to do that. So we're all in the same boat in rural hospitals in New Mexico, some in more critical situations than others. And let me just say that when we shared we were reducing our workforce hours temporarily, there's a lot of rumors going around there about RGH that we're closing. And I just want to say, I want to dispel all of that. That is not true. What we are doing is right-sizing our organization. Our hospital is not in jeopardy, and I do not want anyone in this community to think that. So I wanted to get that out there first and foremost. But we are facing significant challenges. Here locally at RGH, we're getting our hands wrapped around those. We're making progress, and we are going to be okay. We're just in a tough time right now, and we will get through this. So a couple of good things on the horizon for us is we are expecting a large influx through the Employee Retention Tax Credit. We filed for that in May. And so we are expecting that. One other hospital who filed in January is expecting their payment by the end of June. So we're hopeful in another couple of months that we'll see that, and that will be a nice cash influx for RGH. The last thing that I really wanted to share is when we started taking a hard look at our contracts and reaching out to some of our community partners that we deal with, we have just felt overwhelming support. And MHR is one example. When we notified them we were going to have to to stop services on a temporary basis. And they come over and do consults in our emergency room when we have behavioral health patients. They help guide our physicians in what the best disposition is for those patients. They came back and said, you know what? We understand it's a tough time. We're going to continue to provide these services, and we will start revisiting payment probably the first of the year. We've seen that across the board, and so I want to just express my gratitude to our community and our community partners for being in this with us, because we felt their support. So I think that is the overview of what I wanted to share. I have a lot more information, so I would be happy to answer any questions you may have.
Do you have anything,
I
Tim?
have none. I'm good.
Thank
Okay,
you.
we're good.
Are you?
Oh, and I appreciate everything you shared with us today.
Yeah. Well, and
Very
again,
informational.
I just want to say that this is my community, this is my hospital, and we are doing everything we can to ensure we provide the best care we can to this community, and that will not alter regardless of what our financial situation is.
Thank you.
Thank you very much.
Thank you. Does my team, Paul, Andrea, Jeanette, have anything to add that maybe I've missed?
I just want to reiterate the faith that we as a hospital board have in our leadership team, and with Jeanette, Andrea, and Kay being here today. These are tough times. In my prior life, I was a school superintendent. Now I get to travel around and visit school, cities, and counties, and we do work with hospitals at the companies that I work for. And I have to say that walking into RGH, not just because I'm on the board, not just because I live here, but the facility is second to none that I've walked into, and the quality of the staff and the willingness they had to step up, even with fear and trepidation. You know, okay, we'll stick it out and work 32 hours a week. That's an impact. That's a huge impact on a person's life. And the trust they have in our leadership team to say this is temporary, and it appears that it is. And we have a great hospital here, and the transparency that our leadership team has with us as a board and in the community, willingness to do what it's going to take to continue to provide high quality service, which I believe we do. My father-in-law's cousin spent the weekend in the hospital and was very happy with what he received. Not happy to be there, but that's not the hospital's fault. Nobody wants to be in the hospital. And then Kay shares with us the good, bad, and the ugly that goes on, and the hospital world is just so different from anything I'm used to. I still can't grasp finance after 8 years on the board. But in the last 3 years, we have received so much simple information about the bottom line figures of the hospital. And so we as a board have full faith in the direction and the changes they've had to make to steer us through this time.
Thank you.
Thank you, Mr. Bidwell.
And if I'm not mistaken, did you not say that the leadership also took the cuts as well?
Yes, ma'am.
And I totally respect
ma'am.
that the leadership was willing to take the cuts personally as well.
I do too. I just think we have the best team. No one on my team wants anything other than what's best for our patients, our hospital, and our community. And I couldn't ask for more than that.
Sure.
So I just wanted to say it to the people in the group, as the public relations director for the hospital for the last 5 years, I was born and raised in Portales. My mom and dad were born and raised in Portales as well. And I just want to say that time and time again, from the time that I've been here and past, 20 years ago when we didn't have the hospital and the community support that we had. And then time went by and we saw COVID, and I was on the front line trying to get support from the community when we couldn't find certain supplies and masks and things that we needed, and the support that I received. And then now during this time. So all along, I just want to, we have had the community support, and we feel it and we know it. And so I think we were talking earlier about every time there's a time for us to give and a time for us to take, and at this time, I just want to just extend my sincerest thanks to the community and all of the businesses, some in town and some out of town, but they continue to support the hospital. And it means so much to the family members of the people that you were speaking about earlier, the seniors, the ones that we see in and day out to the hospital who cannot travel to Lubbock or even to Clovis for that matter. And so we just pray, and we are thankful that we have the team that will stand up and try to beat this. I mean, it's difficult for us, but we know how important the end result is, and I think that's something to be heard. So thank you.
Thank you.
And I guess 2 more points, and you all know this, but we received a lot of funding during the pandemic. We've not received any more funding this year and don't anticipate any of that going forward. So that's part of what's led us to this is, all hospitals received a lot of funding. We staffed up, and now we're in that phase where we've got to ramp it back down, and that's exactly what we're doing. And I think one last thing, I don't know if Carmela Martinez is still here from HSD, but when we went up and met with the governor's office, we also met with Carrie Armijo, who is the acting secretary of HSD. Part of the issue that we're having is that we get Medicaid supplemental payments, and typically they range anywhere from $2 million to $3 million a year. This year to date, we have only received about $886,000. We were due a payment in May. We were told that will not come until at least July. This was for work that we performed last calendar year. So it was a bit of a perfect storm when you count on these things and then they don't come. There are reasons that they're not coming. I believe they're revising the methodology, and it had to go back to CMS, Centers for Medicare and Medicaid Services, for approval. I understand that. But when you come to count on these supplemental Medicaid payments, when you've got about 30% of your patients who are Medicaid, it's a burden when that doesn't come as anticipated, and we shared that at that meeting as well. Any other questions for us?
Thank you.
I want to thank you all for your time and again for your support. We feel it. Thank you.
Thank you, Kay. Okay, detention, Amber Hamilton, MAT program.
Yes, so I'm going to give a quick update on just the overview of the detention numbers, and then we're actually going to share more about our MAT program. Miss Chris Paulus is here. She's our program manager, and her and I had the opportunity to present on our program at New Mexico counties, and we have a short video that we're going to share as well. But just the highlights from detention. First, our facility count is at 60, which is up substantially. We have 20 females and 40 males. We're housing 11 out-of-county detainees. In regards to billing, Portales Police Department has been billed $3,080. Quay County, $4,575. Chaves County, $1,725. And to date through... this will be through the end of May. Juveniles that we have had to pay for housing is at $252,514. And there are additional invoices to pay. I'm going to let Chris talk more about the MAT. We do have 15 in program, 15 in group, 15 in individual counseling, and 4 currently on medication, and 4 working through the GED process. And as y'all know, we've had the MAT program going for now. We're closing in on 2 years. And we had Chris join us in August 2 years ago, and that has made all the difference in the success of the program. But as we look at doing this, the other thing to highlight is our detention staff. We had a good showing of personnel that showed up, and we were able to receive our 3rd year or our 3rd reaccreditation. Those are good. For 3 years. And so we have that obtained, and we are continuing to work through the process. And for those of y'all that have been on the commission for a while, you know the difference that the accreditation has made in terms of having a much higher level of operation and care and custody practices done out there. And so we're excited to continue on in all the things that we're doing. And I want to show the video.
My name is Richard Lucero.
Nice to meet you, Mr. Lucero.
Nice to meet you.
Can you tell me a little bit about yourself?
Yes, I'm originally from here, from Portales, New Mexico. I'm 51 years old. I come from a family of 6, 4 kids and my parents. I grew up here, till I was like 16, 17, and I got locked up at that age.
Can you tell me a little bit about your drug and alcohol use history?
Yeah, I started, the first time I remember did any kind of drugs or alcohol was when I was like 3 or 4 years old. My grandpa used to sit me beside him while I was little and give me caps of wine. But he bought me a tobacco pipe, like a little corn tobacco pipe, and I sat beside him and smoked the pipe while he smoked his. And I remember that I was like 4 or 5 years old, still in my diapers. And it progressed from there. As I got older, I started drinking. I would steal beer from my parents because my dad was an alcoholic. And so I'd steal beers from him when they were partying or whatever. And I got introduced to marijuana when I was like 12 or 13 years old. I did that for a couple of years, and then I got introduced to cocaine. I got strung out on cocaine. I started using a needle when I was 15. Started shooting up cocaine, and it just progressed from there.
Do you feel that drugs and alcohol contributed to your getting in trouble and making some of those choices?
Yes, because I don't think I'd make the choices. Like, I wouldn't have been doing the things I did if I wasn't strung out on drugs, like trying to get more drugs or me feed my habit.
How do you feel that drug and alcohol use has affected your relationships and employment, things like that?
Well, with my parents, we were always like the relationship with my parents. We were always fighting. Like they would tell me to quit or to do good, and I wouldn't listen to them. I would fight with them. Because it was because of the drugs. Because I was on it. Every girlfriend I've had, we've always either used together or they've always revolved around drugs in most of my relationships with females. And like my jobs, I never really had a job until this last time I was out of prison. That was the first time I really held a job.
Have you tried to stop using drugs or alcohol prior to participating in this program?
Yes, I've been to drug treatment programs, and I've tried to quit on my own. I tried to like say I was just going to do it on weekends, or or just different things like I would try to switch drugs. Like go from alcohol to, like I went from alcohol to marijuana to try to quit. But it was just it was just jumping from one drug to another. But I never could quit. I tried the AA programs, and they didn't work. I think I wasn't ready for the change yet. I wasn't mature enough to know what was important to me until now that I've gotten older.
What made you decide to participate in the NOT program?
Well, first of all, when I got out of prison this last time, my counselor, which was at the mental health, she told me about the Suboxone program, and I got on the Suboxone while I was out there on the streets, and I got on it and I stayed clean on the medicine. I took the medicine for a year, and went to groups. I was in an IOP group, and I stayed clean for almost a year. And I had seen that it worked. I mean, that it was really working, the program, but then I stopped going to the meetings. You know what I mean? And eventually I just stopped taking my medication and fell off. And I got thrown in jail again.
Okay. And so you restarted the medication when you came back into the detention center.
Yes, ma'am.
How do you feel that this is different than prior attempts when you stopped using?
Because this time I really want to better myself. You know what I mean? And I'm not getting all younger. You know what I mean? If I don't do it this time, it's not going to work. And I know that the medication, well, not just the medication by itself, but the medication and the groups, combined, that they really do help.
What changes, if any, do you feel that this program has helped you with?
Well, it's made me realize that there is a way for me to stay sober and be productive in society. It's just that I gotta work the program. You know what I mean? I gotta really want to change, and I feel that I do this time.
Kevin Gonzalez.
And can you tell me a little bit about yourself?
I'm born and raised here in Portales. I'm 34. I was raised by my grandparents at the age of 6. My mother raised me at the beginning of my life, and then she got incarcerated. She had drug problems, and I went to move with my grandparents at the age of 6. And my grandfather was the one who mainly took care of me. My grandmother was really sick. My father worked out of state, so he was still in my life, but my grandparents took care of me. And at the age of 14, my grandfather got laid off from his job, or my father got laid off from his job and took care of me from 14 until I graduated high school.
Can you tell me about your drug and alcohol use history?
Yes, it started when I had my first sports injury. I had surgery on my wrist when I was 19, and I was prescribed hydrocodone. And that was my first experience with opiates. I never really drank. I smoked marijuana in high school, but my first experience was with painkillers.
Okay. How old were you when you started getting into trouble?
When I was about 25, I got arrested for the first time because of drug use. I was in possession of methamphetamines. That was my first experience with the law. The feeling I felt the first time behind bars, I felt alone, I felt hopeless, I felt like I was very isolated in my family. I lost the support from my family.
Do you feel that using drugs or alcohol was related to you getting into trouble?
Using drugs and alcohol made a big difference in my life. A lot of my bad experiences and being in jail have been because of drugs.
How has drug and alcohol use affected your relationships and your life?
It's affected my life quite a bit. Having a degree in radiology, I worked in the hospital. I lost my employment. I lost my car, lost my house. I lost my girlfriend. My relationship with my family dwindled. I pretty much lost everything, and I was very isolated in my life.
Have you tried to stop using drugs or alcohol prior to participating in the MOUT program?
I've been trying to stop using drugs for the past 5 years, and to no avail.
What were the challenges?
Mainly the people I surrounded myself around and not getting the correct support through therapy and counseling.
What made you decide to participate in the MOUT program?
I've had a brief experience with Suboxone in the past, and that was the only time I saw sobriety. I was a month sober when I was on Suboxone, and then I stopped going to the doctor. And as soon as I stopped going to the doctor, I relapsed. So knowing that in that program prescribed Suboxone, I knew it was a good choice for me.
What changes, if any, do you feel that the MOUT program has helped you with?
The MAP program has helped me maintain sobriety, and it's very supportive through groups and counseling. I can reach out to people in the program if I have cravings or urges. It helps me learn new tools on how to maintain my sobriety, and also hear other people's views and their experiences through their drug use. My ultimate goal is to renew my license and get back into the field. I plan on cross-training into ultrasound. That's my main goal. Right now, I do CT and trauma x-ray, but my main goal is to cross-train into ultrasound.
So that's just the video, commissioners, that we were able to share, and we presented a lot of information. Of course, I've asked Chris to just come and present a high level ENMU. KENW was phenomenal and able to come on site and help us record those, video those. They edited them, put them together and everything again for this presentation, because we felt it was important to hear from active participants that are within this. And then we also had person that was sharing their lived experience. They had been a young lady that had been incarcerated 8 years and came out and got started on the MAP program and everything. And so it's really a great, powerful part of what we shared. The other thing is that we're building out the rural program here in Roosevelt County. We've utilized UNM and MDC, but there's no other detention center that's doing it like we are. And so we're able to actually, we love piloting and just learning by mistakes and things that work. And that's been something that Chris has been able to champion. But we've had to try a bunch of different approaches to really see what's going to work in our area, because we have a really challenging dynamic of the lack of support resources on the outside. And you will hear detainees, and Kevin's was released. He just came back into the facility for the filming as a courtesy to be part of this and talk about his experience in the program. But when we don't have the community resources, they will tell you we get great services on the inside. And then when we face release, that's where the struggle is. And a lot of times we try to make those soft handoffs, but there's always challenges with those. And so I would love for Chris just to share some of the high level, what we were able to do, and just talk a little bit more about what she's doing in the facility in terms of curriculum and medication management and stuff. So thank you, Chris.
Thank you, Ms. Hamilton. Good morning, Chairman, Commissioners. Thank you for having me this morning. Since we've had the program in play almost 2 years, I wanted to give you some statistics to what we have for data collection so far. Since September 1st of 2021, the MAT program has had 46 unduplicated male participants, 49 male total, 3 that came back in, and 21 female. Of those, 18 were unduplicated. Of the 49 males, 16 have gone to the Department of Corrections, 1 went to another detention center, 10 are currently incarcerated at RCDC, and 21 were released to the community while 1 withdrew. Of the community releases, 5 have been rearrested with new charges, and 3 have been rearrested for probation violations or failure to appear, failure to pay. So with that being said, our total for the community releases, 62% have not reoffended. We have not seen them come back of our males. Of the 21 females, 3 have gone to Department of Corrections, 1 to another detention center, 5 are currently in RCDC, 1 went to rehab, and 11 were released to the community. Of those 11, 1 came back in because she was found guilty at trial and had to go to Department of Corrections, but she did not pick up any charges while she was out. 3 were rearrested with new charges. So for our females, 73% have not reoffended. So that's what we have so far since the inception. Okay. In looking at our medications, we offer 2 medications. We offer buprenorphine and we offer naltrexone. So for buprenorphine, the number of patients that have been on this medication since it started is 27. Of the 27, 16 of those people denied any opiate use or any problems when they came into the facility. Obviously, that wasn't true. So we found out during their withdrawals and during their incarceration that they had some issues. And so those 16 were inducted. So they were started on medication while they were in the detention center. 6 participants were tapered for withdrawal assistance. That's when they identify with our provider and the site provider and the medical provider that their withdrawal is pretty severe. So buprenorphine can be used to facilitate that detox process, but then they chose not to be on the medication long term. And 5 of them have been continued on verification of community prescriptions. So if someone comes in and says they're on buprenorphine in the community, we verify the prescription with the pharmacy, and then we can continue at that current dosage. In looking at naltrexone, the number of people that have been on naltrexone pills is 6. Naltrexone is used for both opiate use disorder and alcohol use disorder. All 6 of our participants used it for alcohol use disorder. Okay. 2 of these people have received the Vivitrol injection, which is good for 30 days at the day they're released or the day prior to their release. And so that gives them that little window of assistance to get their Medicaid reestablished and get connected. We have a warm handoff to a community provider for them to follow up with to get their next injection. Okay. And we've had to have 2 buprenorphine recipients tapered off after they were utilizing medication because they went to DOC, because that's not an option in DOC. And we've also had to have 2 tapered off to go to a rehab. One of those being New Mexico Women's Recovery Academy, which is part of the Department of Corrections, and the other being Four Winds. So if they're going to a rehab that does not accept MAP medication, we have to taper them off while they're in the facility prior to their release. Okay. So that's our participants and our medications. Our counseling, we still utilize cognitive behavioral therapies. So we have multiple curriculums. We utilize Matrix for criminal justice settings. That's done individually and in group. We do seeking safety for participants that have some diagnoses or looking like a history of post-traumatic stress disorder, which the majority of our detainees do. They have trauma history. They have, rough childhoods. They score really high on the ACEs. They just have a lot of baggage that they come with. And until they can deal with and unpack some of that, it's real hard to create that new foundation and not use those drugs to manage your life. We also use Thinking for Good, which is a precursor to what the IOP programs use. It's focusing on criminal thinking and trying to change your mindset. We also have life skills, basic things like how do you make decisions? How do you create boundaries? Values and responsibilities. What do you value? We do a values inventory and look at what does this look like for each individual person, and how does what you're doing match with what you say you value? And a lot of times they're very inconsistent. We also have things like hygiene, self-care, STD prevention, because if you're utilizing drugs and you're utilizing needles and sharing things, you share lots of things. Some of them you don't want to. So we also have assistance with looking for work. How do you fill out a job application? How do you look for a job posting? How do you interview? What do you dress like? Those things. So those are some of the life skills curriculum that we have. We also have some wellness and education. We did partner with Eastern New Mexico University's social work department. They got a grant to teach a parenting program that we identified in conjunction with them. So last month they started coming and teaching parenting inside out. So that's 2 hours a day, twice a week for both males and females. And so staff from the social work department comes in and teaches this to our patients. We still offer the GED classes. We're in the process of getting staff accredited to actually facilitate the GED testing so they could finish testing while they're still in the detention center. We have recovery group meetings in person now. When we first started, they were Zoom. We have AA, NA, and Celebrate Recovery 5 nights a week currently, and we're looking to expand that. Churches are also back in 3 or 4 days a week, just to provide that spiritual guidance and assistance. And what's coming up? Oh, CareLink. We do referrals to CareLink New Mexico for the discharge so that they can hopefully have a care coordinator. And so I got this data last week that from September of 22 to May of 23, we made 17 referrals to CareLink, 2 for Quay County, 2 for Curry County, and 13 for Roosevelt. Out of those referrals, 11 of them were opted in for services, and 8 of those people are still involved with CareLink and assigned a care coordinator. So that's that little level of security that we're trying to assist in the community. We also do connect with all 3 MCOs. It's just not as smooth of a process as it is with CareLink. One of the things that we are looking to bring in is we're bringing in Smart Recovery, which is similar to AA, NA, but it's not a religious base because some people don't really grasp onto the whole higher power concept, even though higher power doesn't have to be God. It can be whatever you feel your higher power is. It's still not a good fit for everybody. So Smart Recovery is looking at a cost-benefit analysis. The choices that you're making, what are the costs of those choices and what are the benefits of those choices? And it's based on a cognitive behavioral framework. So that's coming down the line. We did apply for the RISE grant and have been notified that we were another recipient this year again. So we are going to be able to continue the program. And with that being said, we are also looking to hire a part-time peer support worker. That person will facilitate groups and things within the detention center, but their primary purpose will be discharge planning and follow-up in the community for at least 2 weeks post-release. So that's an update in a nutshell. I stand for any questions.
Mr. Chairman, I just want to clarify CareLink. I work with CareLink, but we are mental health resources. It's just a branch out of mental health resources. It's CareLink New Mexico, and we have several services programs through CareLink. Just for the record.
Yes, sir.
I really don't have any questions, but I would like to thank you. This looks like a great program, and from listening to you, I'm convinced you're doing a great job. As a former educator in the community, I would like, if I were still teaching, I would want this to take it to my kid, to show to take it to my kids. I think every coach, every teacher needs to be showing that. You know, an ounce of prevention is worth a pound of cure. And a lot of these kids get started, you know, if we could just reach some of them. When they see these detainees in the position that they're in, I think some of them might think twice about getting started. So I would think if there's some way we could outreach to our schools to make this available to them, that would be good. A question. Be sure that I understood the facts on the. You had a word for it when they go back, when they fall off the wagon. What was it? You
Oh, the recidivism.
Okay, well, that wouldn't understand. Okay, now on the male detainees that went through the MAP program, about half of them succumb to recidivism.
62% have not reoffended.
62 have not. So, okay, 40 have. The 40% have, and on the females, like 27 have. What? Huh? So we're doing a lot of good. Is there any consistent? Do you have an opinion of anything that why they go back, why they fail when they get out?
I think one of the biggest challenges is lack of support from the community. I have a detainee that was a male that came back in, picked up a new charge for resisting and evading, and I said, "What happened?" And so on his original discharge plan, he was going to go home and stay with family and go back to work at a DARE. He went home, family had other family come in, so they didn't have room for him. So he's back out on the streets, couch surfing, ends up homeless, job doesn't pan out, so he's back to doing drugs.
I see.
So he comes back in. So we did a different discharge plan the second time. He actually discharged to, for all of us, transitional living in Clovis. And so he's doing extremely well. I've seen him multiple times since he's been there. So that not having that wraparound support when you get out, and a lot of them don't have an ID. They don't have a social security card. You can't get a job or an apartment if you don't have those things. So it's someone boots on the ground in the community who's going to be able to wrap around and help get those basic needs met. Because if you don't have somewhere to sleep or somewhere, not sure where your next meal is coming from, you go back to what's comfortable and what you know, even if it's not good for you.
One last thing. I'd like to personally thank Mr. Lucero and Mr. Gonzalez for stepping up and having their input and just having a frank conversation about it. I think they need to be commended for their involvement. Thank you.
Okay, moving on. Carol, you're up next.
I move to go into indigent, Mr. Chairman.
Second.
Good morning.
We're now,
Yes.
Yes.
We'll vote on that.
I was going to. Motion's been made and second. Go into indigent. And
I vote yes.
favor say yes.
Aye.
Okay, we're now in indigent. Carol, go ahead, please.
Okay.
Sorry.
Good morning, everyone. So this meeting, I've got 33 claims for $22,586.85. I recommend 23 for approval for $8,431.10 and 10 for disapproval for $14,155.75. For Fedco emergency room physicians, 4 approved for $440.65, 4 disapproved for $2,612. 1, the patient had Medicaid. 2, the patients were brought in by PPD. And 1, the patient was not an inmate nor has an application on file. Roosevelt General Hospital, 14 for approved, $7,902.01, and 2 for disapproval for $8,365.75. 1, the patient had Medicaid, and 1, the patient was brought in by Portales Police Department. Covenant Health Systems, 0 for approval, 1 disapproved for $480 for past timely filing. Plains Regional Medical Center, none approved, 1 disapproved. The patient had Medicaid for $2,546. 5 approved for Concord Radiology for $88.44, and 2 disapproved for $152, and the patient, those claims were past timely filing. I stand for questions.
Mr. Chairman, I move that we come out of indigent.
Second.
Motion made and second. All in favor say aye.
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 We're now back out.
Mr. Chairman, I move to approve agenda item 6, healthcare indigent, as presented by Ms. Acosta Flores.
Second.
Motion made and second to approve. All in favor say aye.
Aye.
Passes.
Thanks,
Carol,
Carol.
thank
Thank
you.
you.
Now, Mrs. Hamilton.
Yes.
Or Rick.
Oh, road. We want Ricky
Oh.
first.
Rick,
He's got to come back from vacation.
he hadn't been here so long. I forgot he was.
So many weeks and months, right? Good morning, Chairman, Commissioners.
Good morning.
You know, we've been blessed with a lot of rain in the last couple of weeks, and it's been amazing. But with that rain comes mud. And we've had to strategically move blades around to fix a bunch of roads that were, that storm hit the Panhandle, and it come back around the west side of Floyd and around the Mesa where the windmills are at, and then around Elida, the south of Elida, and all the way to the state line. And we've had 4 blades in the Causey Lingo area and 4 blades in Elida area fixing roads that got tore up. Unfortunately, the Panhandle has 1 blade trying to get all that cleaned up. But we are going to get out there with the loader and fix Miss Hill's culverts, which are still passable, but it needs a little loving. But anyways, talking about that, we like about another week and a half, and we should have all these roads put back together. And we're get all the blades back to where they need to be and doing the regular routine maintenance after that, if we don't get any more storms like we have. We've been cleaning cattle guards also during all this time, and we've had several of them that were pretty full. We also started shredding last week. He got around town last week, and he's moving towards Floyd today, and he should get all the Floyd area by tomorrow, and moving up through Elida, and then after that through Causey. Projects, we started hauling on Highlands. Highlands is getting caliche today, and hopefully we'll get it chip seal this month.
Move your book down. You're blocking your microphone and turning it off. Thank you.
There we go. Is that better?
Yes.
All right. So on projects, LGRF Caps Highlands, we started hauling caliche today. Hopefully we'll get this thing chip sealed by the end of the year or by July. And we're still shooting for Road 6 with a partnership with the city starting in July. And we'll have a crew building that road. And I stand for any questions.
One quick one.
Yes, sir.
Yes or no, Dale? Does Mr. Garcia talk to you?
No, sir.
Okay.
But I have been gone.
I know. Well, you were gone. He called me, but we thankfully got it handled. But I've tried to call him back and hadn't answered his phone. But
Penny's Place, Robert. Is it Penny's Place?
it's right over there by the Scout feedlot.
Yes, sir.
Yeah, he won't. Nope. We got it handled. Thank you.
Okay.
I think.
Thank you.
Okay, Mr. Chair, Commissioners.
I wasn't going to say anything because you was ready.
Well, good morning again. So just a couple of things I want to run down through. We did host our behavioral health symposium on May 30th and 31st. We had the symposium itself on the 30th, and then we had a series of meetings and consultations that following day. We had over 100 attendees from throughout the region, and so we were really excited to see the success of the symposium there and the expertise that came in and what they were presenting on. It was really good information. We are hosting upcoming mental health trainings, and they are scheduled for June 27th and 28th. I'm sure y'all have seen those in your inbox, and we're offering free CEUs for those to really help our local helping professionals. We're targeting everyone in that helping professional criterion. There is a lot of basic type stuff, but with the free CEUs, we're seeing a high attendance. We've already seen over 50 registrations come through for those two trainings. And we're doing basically the identical same trainings. We're just doing one in Clovis and one in Portales to try to accommodate everyone. So excited to see that. And that's all part of the New Mexico Sentencing Commission's grants. So that'll wrap up most of that. We did just attend the summer conference for New Mexico counties, Commissioner Dixon and Commissioner Criswell, as well as the county clerk, myself, and Ms. Paulus. And then we had several detention staff that were able to come up. Lots of good information, lots of material that have come through. So that was attended. We did put in a warranty claim on the healthcare clinic. As y'all are aware, we've had ongoing concerns with this installation, and Mr. Spinks was able to get up there and take some photo documentation of some of the struggles. We really didn't feel like the fasteners that they utilized for the project were adequately sized or installed, and several were already missing, less than 2 years after the install. And so we submitted that claim, and those have been remedied. So we are happy to have the healthcare clinic roof back functional. And we did not sustain any significant storm damage with all the rain out there after years of having that ongoing. So we're glad to feel like we're getting it sealed up. They have started the resurfacing, restuccoing of that building, and we think that that will finish any kind of watertight concern. So we're excited to have that one taken care of. That's a capital outlay reallocation, as y'all remember, we received. And so we're excited to have that wrapped up. So they had finished the detention center, and they are well on their way through the health clinic. We are continuing to meet on the behavioral health facility. One of the things that we talked about at our meeting the end of May was really trying to focus on interim committees. And I know that the city of Clovis has been working diligently to make sure that those works have been done, that we're doing a lot of the groundwork for our behavioral health facility. And they are looking at putting together updates for all of our governing boards. Hopefully later this fall is what we're trying to do. Is another joint event like what we did before, where we had everyone together at the YAM. So we're hoping one time we can get everyone invited and give an update of where they're at on everything with this initial funding. We have initially heard and signed on to some kind of heroes campaign. We're excited to see that Bernalillo County is doing a statewide campaign, and they're actually including all of our rural detention facilities. We're focusing on detention officers and the day in and day out jobs that they do in their situation, just really looking to promote that. We are very fortunate to have our facility staff, but there are many other facilities that continue to struggle with vacancies, as was reported even as recently as last week at the conference. And so we're thankful that we've got most of that taken to, but we still want to participate in the Heroes campaign and really focus on the statewide appeal and promotion of the work that they're doing. Ms. Acosta Flores has been working on ICIP. We had an internal meeting to answer any questions, and everyone's working on revising their projects. This is the infrastructure capital improvement plan. We are going to have a draft with the updates by the end of this month, first of next, and we're looking to schedule a couple of public input meetings again in July. And then we'll have that able to present to the commission. Again, this was one of our initiatives from our vision retreat and one of our bold steps. And so she has really continued to make sure that we stay on schedule and on track for all of that. I'm really excited to share that we have 40 students actively participating in our intern program. They have been placed. We went through an orientation last week, and they are serving. And I believe we have one with us today. So welcome. We're so glad you're here. But it's wonderful to see those students gaining the actual work skills and everything that they are. We're really happy to see where they're at in those. The last thing, both Mr. Garcia and I had to finish a quick-ish conference call with New Mexico counties right before this meeting. And there are currently 24 counties that participate with the state health benefits through GSD. And we've talked about this at the meeting past. We have more of an update. We talked about this at the conference last week as well. But basically how the bill was passed, just to recap, in House Bill 2, the legislature sent it with language to increase health benefit premiums and to supplement $23 million from the general fund for the fund deficiency. Both of those items were vetoed by the governor, and that has kind of set a lot of other things into action. So as a result, members that have been participating have all received, first we received a general email of the assessment and the notification. They are looking to try to collect a retroactive bill, which we have several concerns on the legality of that, as we've shared before. And then they've also sent a bill for the upcoming fiscal year 24, but they refuse to increase premiums at their level. So it's very interesting, in my opinion, how they're trying to tax a local government with these unknown financial burdens. But as a result, what we're going to need to do, we heard late Saturday from New Mexico counties, they're looking at putting together a plan and an approach on steps forward. And so we need to have a special meeting, ideally on Friday afternoon, if we can get a majority of y'all available, to just have an executive session to discuss threatened or pending litigation as a result of this action from the state. And that is where we will have counsel from New Mexico counties, as well as our general counsel here for the counties present to discuss the updates of what comes into play this week and the status. We could not once we received this, it was past the point of when our agenda was published and it was unable, I couldn't amend it after that point. So we have to have a special meeting.
And that would be at
If
what
possible.
time?
Well, if we can get a majority or ideally all of y'all available, even if it's by phone or Zoom, if we need to, Friday afternoon looks like the best time. We didn't set a time. We wanted to see what worked best for y'all. If 1 o'clock on Friday worked, or 3 or 5 or whatever.
I'm out of town. I know that for a fact.
I can be here.
God willing, I'm out of town.
There's 3 of us to be here.
On Friday afternoon, like 1 o'clock work for y'all right after lunch? Perfect. Thank
Since
y'all.
You're buying
And I can
lunch
do
that
Zoom.
day. Is that correct?
Don't come hungry and I will buy you lunch.
Okay,
Sardines and
so go ahead and make that
Public announcement.
public announcement. And we'll make that work if that makes Mike happy.
I'll be here. Well, either here or by Zoom, whichever I can
Okay,
do.
I hadn't heard anything from y'all, and I hadn't bothered you just a little bit.
Well, Mr. Chair, I did have something that I wanted to bring up. I know that I wanted to bring it up to the whole commission. I know that there has been some back and forth between the city of Portales
Uh-huh.
and Roosevelt County regarding carrying the load for and how the load is carried regarding inmates.
Yes.
And I know the agreement has more or less expired that had been in place for the better part of 20 years.
Yes.
And so I've done, myself and members of my firm, we've done some research on what the commission's, what the county's position is. And the short story is, I think you all are in a pretty strong bargaining position if you want to take that position.
We do.
The controlling statute is 3-18-20, and basically it says that that cities can house inmates in county jails subject to requirements of law and requirements set by the Board of County Commissioners. So there are a couple of attorney general opinions that are out there that are kind of at odds with each other, in my opinion. There's one old attorney general's opinion that says that you can only charge for the city for inmates housed or charged under city crimes, municipal law crimes. But there's no law that says that. And so I think it's kind of a weak position respectfully, for the city to take that position. The other thing about Attorney General's position is they themselves are not law. And they have some persuasive value, I suppose, with the court. But when you look at the import of the statutes and the one that I just mentioned, that there's a certain element of fairness that you can discern, that cities are allowed to house their inmates in county jails, subject to requirements set by the county. So there's an element of fairness that comes into play, and I think that to the extent that you all need it, you have a strong bargaining position if you want to take it. And I wanted to put that before the whole board in case you all had any questions, and I've talked with Commissioner Dixon as well. And so if you have any questions, willing to answer them.
This one I do not, Mr. Chairman.
No, at this point, I'm all right. But it is good to know that we have a footing in this deal.
Yeah, I think, Mr. Chair, I think, and not that we want it to go that direction, but you're always thinking about, well, what would a court say? And I think if it came to that, I think the court would say that the county has grounds to put requirements on how inmates are housed and what the costs are.
Well, for the record, though, all counties that have detention centers already have that in place at a much higher rate, right? With
Well,
cities.
Mr. Chair, Commissioner Lopez, I think sometimes there are these tensions in different places in different parts of the state. And I know that in Bernalillo County, where I recently worked, there is often considered an imbalance because most of the inmates come from Albuquerque. but that's not necessarily how all the cost is shared. So I forget the number, but I think it's something like 70 or 80. I think it's about 70% of the inmates housed at MDC are actually arrested in Albuquerque city limits. But I don't think the funding shakes out the same percentage.
Right. Okay.
And Mr. Chair, Commissioners, I have one more thing. So just to note in our meeting minutes, we do need to note that we have approval and certification for our submission of the preliminary budget that the commission approved and adopted in May, and that was received by the state and approved. There are a variety of additional annual requirements that will come as y'all look to consider your final budget at the end of July. But we do just need to note that our interim budget was approved. Now I would stand for any questions.
Mr. Lopez, no question.
And nothing on my agenda.
I don't, but I do have some other commissioners when we get there.
We're quickly approaching.
But I don't have any questions for her.
Okay, now we have approached. Mrs. Dixon, would you like to share something?
I would love to. Thank you.
Well, that's wonderful.
Okay. Sarcasm will get you everywhere. Okay, so to start off with, I would like to say that Commissioner Criswell and I have been working on the negotiations with the city and county. We meet challenges along the way, but I don't think it's not anything that we can't work through. I think it's been going very respectful so far. So I think it's all going well there. And I greatly appreciate his help because he's always right there with every answer. So that's been great. Also, I had a couple of things. Amber, do you know if we're going to be doing an Alzheimer's walk this year? And if so, when?
So, Commissioner, the typical approach, I think it's, I don't even know. I'll need to look, but we hosted it last year. So this year it'll go back, and I believe it should be the city of Clovis that would host it because all
Okay.
4 entities do it together. And so I think it'll be the city of Clovis to host this next time.
Okay.
And I want to say it's like October, but I'll have to look.
Okay, thank you. And also, I wanted to ask you, do you have any idea on the, I know that the town of Elida, they had asked me that they had made an offer to the sheriff's department that was going to share with you on the $100,000 that they were going to do for LEPF for us. I didn't know if that's something you're working on.
I haven't met with Sheriff Sanchez yet. He has shared the initial documents, and he's doing some research and some conversation. But no, we
Perfect.
haven't moved forward on anything yet.
Okay, and Commissioner Criswell would like to know if there is anything that we can do as far as Little Wranglers goes, given like a discount or something for the Little Wranglers to do their stuff every year.
That I'll talk on that just a bit.
Okay.
Commissioner Savage and I both have been approached by parents or board members of that association, and everyone that we have talked to, we've guided back to Mrs. Hamilton, explained that because of the anti-donation law that's in place, we can't just give it to them.
Right.
And in the past, Mrs. Hamilton has tried to work with them and, to lower the cost. And some in the past years or so, the parents have decided that's too much trouble. So they decided that year they would go ahead and pay the full cost. Am I correct, Mrs. Hamilton?
That was my understanding from the board.
Yes. And so, as far as lowering the cost, if they have they come and talked with you, I have given the office number
Okay.
and Mrs. Hamilton's name out to the board members. And if they're not willing to go meet and discuss and try to do something, it bothers me that all they can do is complain. But so if that has anything to do with Commissioner Criswell's request, you might pass that on to him.
Okay, thank you. And
And Commissioner Greider, I'm happy to share some of the prior agreements I did with both Commissioner Greider and Commissioner Savage when they called after their initials. They did contact us and book with our office, but they haven't ever called back or done anything to follow up on that. We have worked with them in years past. We had them come out and help us with mowing and weed eating, doctor and ant beds, painting. I mean, we could find a series of work out there in exchange and do the exchange of goods and services for the rental fee. And we were able to lower it in the past. So it certainly can be done. We've always been happy to work with any of those entities. There just has to be some kind of communication and request for that. It was just our understanding before with the prior board, they just shared that now it had gotten so large that a lot of the participants weren't here local. And so they weren't able, they didn't come and help, and it was an undue burden put on a small group of parents that were here that had to shoulder that burden. So,
okay, sounds good. And I think that's all I have. So thank you.
Okay, Mr. Lopez, are you talked out?
No, I have nothing to say about any issue at this point. Oh, you mean for commissioner's line item? No,
Yeah.
I'm fine. I thought you had already gotten to me.
I was just checking.
Okay, thank you.
Mr. Savage.
I really don't have anything to add other than to comment that Chairman Greider's appraisal of the situation with the Little Wranglers is accurate. I visited with Peyton Terry, and more or less we had the conversation, and the board of directors, I'm sure that a majority of the board of directors are well acquainted with Mrs. Hamilton and know where her office is. I think they know her personally. And again, I recommended go talk to her. She will try to figure out a way to lower the cost, but you've got to go and work something out. And so I think the ball's in their court. Thank you.
Well, that's just lovely. Okay, if we're done with this, we're moving on to item 7. 7A, request for approval for the type 3A summary division. Mr. Montiel.
Morning, Mr. Chairman, Commissioners. These two are pretty, I'm sorry, but I can't be up against the wall. So these are pretty simple summary subdivision and replat that we're going through for Roosevelt County. The first one is Mr. Robert Maldonado and Tina, and I'm probably going to butcher this name, Duzik, have applied for a type 3 summary subdivision, and it's named Hideaway Estates. This type 3 summary subdivision is located in section 30, Township 1 South, range 35 in Roosevelt County. It's about a half a mile from South Roosevelt Road P and 4, about half a mile to the intersection of P and a half and 4. It's right there in that little corner, catty corner. And so what they want to do is create 4 lots named 1 through 4. The biggest lot, the maximum will be 2.314 acres. The minimum 1.837 acres. The remainder of that parcel of land is going to stay out of the subdivision, and it's going to have 7.433 acres in size, but it's not going to be attached to that subdivision. There's going to be 4 lots. It falls under our Article 6 summary subdivision review process. There were no adverse opinions from utilities or surrounding landowners. It has gone in front of the city of Portales, and they approved it. They have met all the rules under the type 3A summary subdivisions and the Roosevelt County subdivision ordinance. I ask for your approval. I stand for your questions.
I move to approve agenda item 7A, Mr. Chairman.
Second.
Motion made and seconded, approve 7A. Ms. Dixon, how do you vote?
Yes.
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 Yes. 4 yes votes. Johnny, Johnny had a question.
Yes, sir.
Now, all this is in the county, right?
Yes, sir.
Why does the city have to approve it?
There is depending on the population size and what classification it falls under, there's a 3-mile planning jurisdiction with the city of Portales or a municipality, or up to a 5-mile planning jurisdiction with the city of Portales because of their population and size. Now, with that being said, it could be that the property at one point could be annexed into the city or the municipality. So that's why they have to follow some of their ordinances or rules. So that's why we have that dual signing jurisdiction.
Yeah, and I understand. But it is funny to me that sometimes the city is real quick to draw their lines on the city limits and complain about the county not taking care of their part. Anyway, go ahead.
There are some questions that I would like to talk about, maybe in another meeting, as far as the lines or boundaries that we're talking about and how they were developed and other issues being not taken care of or brought into it. But that's for a whole other conversation.
I know. I just had to say what I was thinking. I'm sorry. Let's continue on to 7B. Go ahead.
Oh, yes. Hold on, clear the mechanism. Okay, here we go. James Hansen has applied for a summary replat of lot 49 in the Chalk Hill Farm subdivision. This replat is located in section 32, township 1 South, range 34, or 4/10 of a mile north of South Roosevelt Road 6 and Chalk Hill Road. The proposed summary replat contains one lot. The proposed replat will divide lot 49 into 2 equal lots, named the north half lot 49 and the south half lot 49. I don't like that, but again, the maximum lot size is 1 acre and the minimum 1 acre. It falls under Article 6 summary review process. No adverse opinions from any of the utilities companies or the surrounding landowners. It has met all the rules and regulations of our ordinance. It has been approved by the city also. I ask for your approval of this replat.
So moved on agenda item 7B, Mr. Chairman.
Second.
Motion made second to approve 7B. Mr. Lopez?
Yes.
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 4 yes votes. Motion passes.
Thank you.
Let's see, in just a moment.
Okay.
And we're moving on to item 7C. Presentation request approval of FY 23 capital asset inventory listing. Mrs. Lilly.
Good morning, Commissioners, Chairman. Included in your packet are all the capital assets for the county. All the capital assets have been submitted to the department head and or elected officials for their review and their certification. I have received all of them in return. With that, I'll stand for any questions.
And I'll move we approve 7C.
Second.
Motion made and second to approve 7C. Mr. Savage, how do you vote?
Yes.
Mr. Lopez?
Yes.
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 4 yes votes. Motion passes. And we have Mrs. Hamilton up next on 7D.
Yes. Good morning again, Commissioners. So as part of the follow-up from the conversation at the prior meeting in regards to consideration of a speed limit reduction on South Roosevelt Road from New Mexico 88 East, we have that listed now as an action item. In the past, what we have done is had the discussion and then directed, the commission has directed myself and Mr. Rovato to move forward with talking with all the necessary parties that would be involved, the first responders and all of that, area residents, There's several steps to that. New Mexico DOT, anyone that we interface with, and then barring any issues or discovery, then we would bring forward a resolution. The last time we did this was in 2019, and it was in regards to North Roosevelt Road AV, and the speed limit limitation there. Y'all went from 55 to 45 miles an hour on that roadway. So the statutory authority for the commission to establish speed limits on the roads is it's in the New Mexico State Law 66-7-304, and the speed limit is deemed to be reasonable, safe. You can alter it, and we have to post signs to that effect. So Mr. Lotto's here for any questions as well. If there's any sections or limits that y'all want to look at, if it's only the paved section, if it's all the way through the entirety of the road, however you would like to discuss that and set those explorations.
Rick, what I did is I had complaints on 8
Right.
potholes. And I drove all the way down 8, way down Pasadena and around east of Arch, and looked at the whole thing. And coming back, I noticed there was a 55 mile an hour speed limit. And on a road that narrow, no shoulders, those big potholes, I thought that 55 mile an hour would be dangerous because normal human behavior, it says 55, they're probably going to drive 65. And, I live on a chip seal road, and I know that the speeds are excessive. When you chip seal a road, it's nice, but along with the chip seal comes excessive speeds.
Right.
And so I think that personally, I think the 55 mile an hour speed limit is excessive. I think they need to be lowered down because that is a farm community, lots of farm equipment, no shoulders. And I know we're working on improving that road. When we do improve that road, then, it's going to add to the speed still. So I was thinking we'd be better off maybe to put that speed limit down to about 45. That's what I was thinking. But
Well, we will reach out to the state of New Mexico and do a traffic study, or traffic count. Reach out to the sheriff's office and get their opinion, and the residents, and also the Arch Fire Department, and probably the city of Portales, also their first responders, and see what they think. And then we'll do the whole process, and then come back in front of the board and let y'all know what the study says and what they recommend.
thank you.
Yes, sir.
And thank you for working on the potholes.
Yes, sir. We did get the potholes filled. Haven't been out there in 2 weeks, but we'll see what it looks like.
That rain really. I'm glad to get the rain, but you know what it does to the pothole.
Thank you, Mr. Lotto.
Thank you.
Okay, moving on to 7E. It's Lily.
Hello again. We'd like to request 2 commissioners to participate in the FY23 annual financial audit. We will soon be starting on that. So I think last year we had Mr. Lee and Mr. Savage. I know you're excited.
And they're all saying Commissioner Criswell. in
Yes,
the
that's
air."
who I nominate. I nominate Criswell.
That's exactly what I was thinking.
And by that, I really think I can appoint Mr. Criswell, since he's not here. And Mr. Lopez, if
I
you're-
cannot do it. I've been there, done that. I've paid my dues.
Oh, I'll do it. I mean,
Well, Mr. Savage is right here
fairly
close,
local,
and
I'm
he is
kinda close.
very, very wonderful person to volunteer. So this year, I think we'll have to use Mr. Criswell and Mr. Savage to serve on this financial audit. Now, then, I think we're done with this particular item, right? And we're going to take a short recess.
So it might be cleaner if you just do a quick vote on that one,
Well, I think
on the designation, and then it's just tidy.
I move the chair appoint 2 commissioners to participate in the FY23 annual financial audit meetings.
and that's the second.
I'll second. Oh,
And it's had a second given to it. Mr. Lopez?
yes.
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 4 yes votes. It is final. Mr. Chris will be serving on that board. Now, we now have a 5 or so minute recess, and we'll take back up